Okay. Now for the next aspect of history taking and physical examination in obstetrics and gynecology is you are trying to take history of gynecology. Don't get me wrong. Gynecology is you're actually trying to deal with the information about womanhood, not pregnancy. Okay? It's obstetrics that you're actually trying to deal with pregnancy. But even if a woman comes with pregnancy, you can still ask her questions generally about her womanhood. Do you understand? So that's why it's a thing in both of the practices. So in gynecology is actually a very important aspect in the overall assessment of a woman, either she's pregnant or not. Okay, so it helps to uncover reproductive health issues, why she's having menstrual irregularities, the sexual health concerns, and fertility challenges. So reasons why you're actually doing a gynecological history is you are trying to diagnose conditions like endometriosis, fibroids, polycystic ovarian syndromes, pelvic infections. You're trying to assess for menstrual health. You're trying to see if she has used contraceptives before. You're trying to see how her sex life is going. You're trying to access all those fertility issues or menopausal issues. They are trying to also screen for cervix, cervical issues, uterine issues, ovarian issues. Okay. So key components of gynecological history, that's things you ask this woman. When did she start menstruating? Is her menstrual cycle regular, 28 days? How is the flow? Is it too much? When she's menstruating, does she feel so much pain? What was her last menstrual period? Okay. Then you can also tip in, to just ask her around obstetrics too, where you try to ask her about the number of pregnancies she has ever had. So if she has ever had any issues in the previous pregnancies. Okay, and how did she deliver? Has she ever had any abortions and all of that? The contraceptive history, first of all, you ask her whether she knows what contraceptives are and if she has ever used them. They can now call names of common contraceptives in that locality where you live. Probably she might not know it as contraceptive, but when you call their names like Postinol, she'll now know it. Okay, so sexual history, when did she start having sex? How many partners? Does she have pain when having sex? Does she feel the urge for having sex? Does she have has she ever had a sexual transmitted infection? The fertility history, you're trying to ask her for previous fertility treatments she has ever had any. You're trying to ask her for her partner too. Okay. The menopausal history, that's if she has gone past menopause, you ask her when did she actually had her menopause. Was it at the 45 or was it up to 50? Then past gynecological history, you ask her if she has ever had any of those tumor growths, she has ever had any tests, okay? Then if she has ever had any surgeries, okay, in the pelvis region of the body. So these are the things you actually look out for when you're trying to ask questions around gynecology history in a woman.